All right, let's welcome our next inductee, Dr. Thomas Dean of Wessington Springs.
Dr. Thomas Dean is a healthcare leader who is not only dedicated to excellent care across the lifespan of patients, but one who strives toward national policies that can help develop a healthcare system that both responds to individual needs and underserved areas. As a leader, Dr. Dean served as a medical director of his local clinic system in Wessington Springs for 26 years and as chief of staff of the hospital for 36 years. Known as Dr. Tom, Dr. Dean feels that the best medical care occurs when physicians can practice in one place for the long term, knowing and understanding their patients. During the COVID-19 pandemic, Dr. Dean took the national spotlight and spoke about the challenges rural healthcare facilities have faced.
Wow, that light is awfully bright. What to say at a time like this? It is more than a little bit overwhelming. The thank yous, they're a long list, as people have noted. Thank you to the Hall of Fame organization for promoting and developing this concept. Thank you to Bob Sutton and the Avera crew for honoring me with the nomination. Thank you to the Horizon organization, and particularly to the gang at the Gerald County Clinic and the Horizon and the Avera Memorial Hospital, who have been my second family for all these many years. Most especially, I want to thank my own family, who put up with me traipsing around the country, often asking sarcastically, "What are you going to talk about this time?" My answer was always Greek history, which of course I know nothing about. And especially, most of all, I would thank my wife, Kathy, who's been my practice partner and my life partner, my strongest supporter and my most severe critic. But she is the one with the wicked red pencil who edits anything that I write. I could not have been more fortunate to meet the fearsome head nurse in the delivery room at the University of Washington Hospital on my first day as a very frightened young intern. But it worked out pretty well, and we've had 50 years together. So, as I look back and try to come up with some meaningful reactions to this very great honor, the very first thing that comes to mind is that I've had the good fortune to work for a very long time in the supportive environment of a small rural community. I have had the opportunity to watch, to participate, and to learn from that community, seeing up close what works and what does not. I have seen good people do bad things, and I've seen bad people do good things. I have observed that when people are angry or frightened, very often they make bad decisions. I do hope that all that has helped me to make better decisions. All this experience is summed up in a quote from Dr. Gail Stevens, written about 40 years ago. Dr. Stevens was one of the early promoters of family medicine. I like to refer to him as our philosopher. In his words, time is an important variable in the evolution of moral credibility. It entails living with the consequences of one's decisions. Time exposes one's idiosyncrasies and temporary enthusiasms. It is the crucible in which character is built. Time changes one's view of patients and their capacity to change in their own best interest. This knowledge is hidden from the itinerant physician who sees only short-term results and is often tempted to cynicism. I believe Dr. Stevens' insights have direct bearing on some of the very troubling problems that our society faces today. The U.S. Surgeon General recently issued an advisory calling attention to and raising alarm about the increasing loneliness and isolation in our society, a rise which represents a major threat to the health of our people, and, in my view, a real threat to the way of our way of governing ourselves. Solid medical research has clearly demonstrated that social connectedness, or more specifically, the lack thereof, has a direct and negative bearing on human health outcomes. Life expectancy in our country has declined significantly in the past several years. Some of this is related to COVID, but major contributors to this very disturbing finding are what has come to be known as deaths of despair, deaths from gun violence, alcohol, drugs, and suicide. These evolved directly from the concerns raised by the Surgeon General. In small communities, we are not immune from these challenges. We do not always agree. In fact, we sometimes get into some pretty vigorous squabbles. But I do believe there persists a degree of social connection and an element of personal identity that is preserved. I believe that the impact of loneliness and isolation extend well beyond their impact on human health. The breakdown in honest political discussion and the emergence of tribalism is a direct result of these factors and represents a serious threat to our democracy. How to respond? We need to reach out and talk to each other, especially to those who have different opinions. I'm by nature an introvert. Reaching out is hard. Nonetheless, I firmly believe that it is the only way to get beyond the broken politics and tribalism which so dominate our public policy making today. Enough. I am deeply honored and appreciative of this recognition. I accept it with great pride, but also with humility and with a real sense of concern. There is so much yet to be done. Thank you.
Thank you, Dr. Dean. Community is so important. I love your message.